So we're pleased to announce the speakers for the final poster session of the day. Questions will be at the end of these three presentations. Again, you do have a notebook in front of you. If you have a question you want to jot down for any of the individual posters, we encourage you to write down the topic and the speaker that you'd like to direct it to. So allow me to introduce all three. First, Katie Beth Sharp will discuss intellectual disability, autism spectrum disorder, and problem sexual behaviors. Jessica Herwig and Allison Jones will discuss cardio drumming, a recreational therapy intervention for mental illness. And then Michelle Van Outer will discuss happiness and employee engagement. Happiness, I think, is a lovely way to end the day. So I would like to invite Katie Beth Sharp to the podium.
All right, can everyone hear me? Perfect. So as Cassie wonderfully introduced me, we were talking about intellectual disabilities, autism spectrum disorders, and problem sexual behaviors. So just a brief overview, when you're looking at the prevalence rates, I pulled this directly from the DSM-5. So intellectual disabilities occurs approximately 1% of the population. Same with autism spectrum disorders. And then when you're looking at frauderistic disorders, you're looking at about 30% of the population, and that's individual diagnoses. There are not prevalence rates for comorbid with these three disorders. So this is a case study that I am currently working on, trying to get through IRB. And one of the reasons that's so important to me is because there is no evidence-based treatment for these disorders comorbidly. You do find some interventions for problem sexual behaviors with intellectual disabilities, with autism spectrum disorders, or with problem sexual behaviors in the sexual disorders category, but the interventions look very different. So when you have those three together, there really isn't any data to pull from. So what we were trying to do in the hospital is to find out how can we improve this patient's quality of life? How can we help them access their community when our traditional interventions weren't working? They weren't working to the point that we're not able to get this person discharged and transition back to the community. So we tried looking at the research. That wasn't there. So then we started pulling clinical expertise. We were pulling from psychiatry, psychology, nursing. I know we've had occupational therapy, we've had rehab, we've had all different disciplines trying to work, and we really just weren't seeing enough progress for the community to be willing to accept this individual. So we see that problem sexual behaviors are a significant barrier to the community. That's something the community pays a lot of attention to. Anytime we mention sexual violence, the community kind of reacts really aversively, as they should. And so trying to find evidence-based, I was really pulling a lot from the paraphilic disorders, in which you look mostly at psychotropic medications, and we didn't see a ton of positive interventions from those. A lot of what you see with the paraphilic disorders is hormone treatments rather than true psychotropic medications. And so there is no data currently on using hormone treatments with intellectual disabilities or autism, much less both of them combined. So when you're looking at how to design an intervention, you have to then start taking into account, again, those patient values, as Dr. Akoli was talking about earlier. Most importantly being quality of life, which we're not currently able to provide with him hospitalized. So we're looking at how do we define problem sexual behaviors for this individual. We look at behavioral acting out, so things like seclusions, holds, PRN medications, IM medications. We're looking at physical aggression, verbal aggression, and sexual aggression. We're looking at physiological arousal, which we measured using heart rate, so that we could see, is the hormone treatment decreasing that physiological arousal, because that's what the data currently shows in the paraphilic disorders. But we also wanted to capture that psychological arousal, that psychological distress component as well, because what we've seen in the paraphilic disorders is that that piece doesn't really seem to decrease with just hormone replacement therapies. So currently we're trying to measure whether Depo-Provera is effective at decreasing behavioral acting out, physiological arousal, and psychological arousal. All right, so what you'll see on this first slide here is the free testosterone levels. So this is January 7th is our first baseline. So this is before introducing the Depo-Provera. You'll see a slight increase with the first dose of Depo, and then you start to see those testosterone levels lower out. We have started to see a little bit of an increase, and I think there's some titration pieces that we are needing to do with that. But you'll see that the heart rate, so that physiological response, is following very closely with the hormone levels, which we predicted. We're also looking at behavioral acting out, and there's a lot of different pieces that are mapped onto this data. And so I didn't want to include all of those graph lines because it would have made the graph really messy. But you'll see when we implemented the Depo-Provera, there was a significant decrease in behavioral acting out across all of our target behaviors. You'll see the initial interventions were included around May or June with like our current medication regimen, implementing behavioral services as we traditionally would, and that just was not enough to truly decrease what we were seeing. The piece that I find really interesting here is that physiological arousal has not changed. It has remained consistent across all of our trials. And so what that says to me is that the Depo or the hormone treatment itself is not enough. So we cannot just provide the hormone intervention. We have to be providing other pieces. And so what we're looking at now is adding in those distress tolerance pieces. So we're using things like the skill system. We're going to start incorporating exposure as well to try and work on that distress tolerance piece to see if adding that in allows us to get a little bit better response. And I wanted to do that in a graduated way so that we could see the true hormone intervention and then also hormone intervention with the psychological intervention. So overall, what we saw with Depo-Provera with this case is that it's very similar to use within the paraphilic disorders category. We see that physiological piece being addressed, but you're still seeing that psychological arousal still present. So what we need is, again, further evaluation. We're still very early on in this intervention, but also I think this is a good starting point because there are no true interventions or treatment centers for individuals that have this group of comorbid diagnoses. And so you have a lot of individuals who are really stuck in a place that they're not able to access their communities, their quality of life is impacted. And so this is a great way for us to kind of open the conversation within the community. All right, that's all I have.
Hi, my name's Jessica.
And my name's Allison, and we're recreational therapists at Eastern State Hospital.
And we provide both group and individualized therapy to adults with mental illness and substance use disorders.
Our goal as rec therapists is to increase recreational activities in order to improve their quality of life.
Last year, Allison and I had the opportunity to go to a recreational therapy conference where we were exposed to an intervention called cardio drumming. We had so much fun with it that we decided we just had to bring it back to the hospital and let our patients do it with us. So our presentation will just be an overview of what cardio drumming is, how the group is going so far, and where we hope to take the group in the future. Green?
Alrighty, so what is cardio drumming? Cardio drumming is basically a fitness phenomenon that incorporates, we have music, rhythm, We have like different dance routines, and then we use drumsticks and yo-go balls as the drums, and we kind of just come up with different beats to different songs. So basically, it's like any other fitness group that you would go to. You would have the instructor that kind of leads and coaches you, motivates you, and then the participants kind of just follow along to the best of their abilities. A lot of times with the patients, I'll let them know, like, we're not here to be professional drummers. We're here to be the best version of ourselves and to see improvement within ourselves. So even though this is a new approach to healthcare, it's already been seen in schools, gyms, teen and senior centers, nursing homes, and then psychiatric hospitals as well.
So just a little bit of history about how cardio drumming came to be. So the idea of drumming for therapeutic benefit is not a new one. It's been around in different cultures for centuries. You've seen drumming circles that foster a sense of connectedness and socialization. Some people use drumming as a way to connect with a higher power or engage with their spirituality. And then some South African and Central African countries still use it today to address difficult social situations. So they use it to come together to get through difficult life situations and transitions. But the idea of adding aerobics to drumming is relatively new on the fitness world. It really started with the beginning of a group called, or a program called Drums Alive, which actually came to be in about 2002 when its founder actually experienced a hip injury. And so while she was recovering, she used drumming as a therapy and wanted to know why it was that drumming made her feel so much better mentally. So she began doing research and really brought that research to fitness. And it's now been mainstreamed, and you can find it, as Allison said, in all sorts of different settings, but it's really popular now. And even here at the Lexington Senior Center has a version they call Beat, Drum, and Boogie. So you can see the seniors working out there with it as well.
So there are so many benefits to cardio drumming. The one thing that really stuck out to me is it actually works your entire brain. So by combining physical activity and rhythmic energy, it synchronizes the left and right hemisphere, improving intuition. Then we have the sound of drumming alone. It generates neuronal connections, leading to a deeper sense of self-awareness. Drumming synchronizes lower areas of the brain, which produce a feeling of insight and uncertainty. And drumming generates a natural high, increasing alpha brainwaves, producing a feeling of well-being. That one alone probably relates to us on a, kind of the same level as anyone that's dealing with anxiety, depression. So kind of just giving them that feeling of certainty can make a world's difference. As for the other benefits, we could go on, but these were the ones that we thought were most beneficial with the population that we work with. So we have an improvement in self-esteem. There's a lot of patients that come in and they tell us, we have no rhythm. I don't know how well I'm going to do at this. We kind of just tell them just to have a good time. And you can just tell by the end of group, they already feel more confident in themselves. And then we have a decrease in aggression. Once again, a lot of times we have patients that have aggression problems, and we kind of tell them to take out their aggression on the drums. And they kind of seem a little less angry, so that's nice. Then we have enhanced focus and concentration.
So what cardio drumming looks like at Eastern State. So when we first brought the group to the hospital in February of this year, we developed goals. So our goals are very broad right now, but mostly we just want our patients to engage in a structured exercise routine so that they can meet either their physical, cognitive, or emotional wellness goals. And we know goals look different for each patient, so we're really allowing them to come into group and work on what they want to work on. We also look at following directions, just from the nature of the group. As we're leading, they follow. Improve self-esteem, as Allison said. She'll talk about a patient later that we've just seen grow so much in that area. As people master new skills, you feel more confident. And then as any group setting, you're working on social skills and then respect towards your peers. So that's something we're always looking at improving. So we also develop group procedures so that our group has routine, so that each time patients come to the group, they know what the expectations are. So we arrange our group in a circle. This is actually our gym and the equipment we use. So we do that for multiple reasons. One, so that we can see all the patients at the same time for their safety, so we can coach them as well. But two, because we can all see each other, it really builds the energy. We can support each other and feed off each other's energy. Before we begin our group, we always introduce the group, lay out the expectations, kind of how the group goes, what to expect. And then we do a light warm-up session just with our lower and upper extremities to avoid injury. We don't get too strenuous in the group, but it's always good to be warmed up. And then we do our 6 choreographed routines. So they're the same songs right now currently we do each week so that patients can come back and remember those songs and build on those skills. At the end of the group, we cool down, so we'll do a light stretching and cool down. We always like to play a motivational song at this time. Right now, we're kind of stuck on Journey's Don't Stop Believin'. It just ends the group on a really high positive note as we celebrate the successes that we've made in group. And then we always like to leave our patients with education on community resources. So patients are actually asking, where can I do this in the community? How can I do this at home? So we like to educate them on the different recreation centers they may be able to do this at home, and then also the supplies they could do if they're not able to access a center in their community. And then we end the group with at least 10 minutes of independent drumming or freestyle drumming. This way the patients are able to express themselves in a way that they would like to. So they may not drum. We encourage dance. They just want to walk. They just want to sit and listen to the music. It's just a way for us to celebrate and relax at the end of group. This next slide is going to be a video. I apologize for the low quality of the video. It was caught on camera on a cell phone, but this will be the staff demonstration that we did at the hospital. It's just about a 20-second snippet of what it looks like at the hospital. So you can see we're arranged in a circle. Everybody can see each other, and the energy just really builds as everybody gets into it. So it's a good time. You cannot leave group without a smile on your face.
So we've received very positive feedback from our patients. Well, we always like to let them know, like, how was group? How did you feel about it? Some of the responses that we've gotten, I've never felt so alive. This is something I can do at home. This is so much fun. I didn't know something like this existed. Where can I do this in the community? The takeaway point is that these patients are coming in learning something, and they want to use that once they get discharged. They want to find out what resources, where can I get involved? And that's kind of what we're all about, is helping them find the resources and use what they've learned in group when they get discharged. So we followed 3 different patients that have been at the hospital for a while, and kind of just based on behavioral improvements. So we had one patient, very withdrawn, didn't really participate in any other groups that I've seen, hardly smiled, low self-esteem. By the end of the group, this patient, she was smiling, she was confident, and she was very engaged. So the next patient that we had, this patient, one group, they came in and they were just very angry. They were very agitated by internal stimuli. And as soon as we put the drumsticks in their hands, like they were getting into it, and they didn't even remember why they were angry in the first place. Then the third patient that we had, an older patient, they always said that they couldn't really do any kind of fitness activity. They just didn't have the endurance for it. Well, once we put the drumsticks in their hands, they were able to participate the whole entire time. And this is an activity that you don't even realize you're exercising. So a lot of these patients, they're having a good time, they're exercising. They're not only doing that, but they're improving themselves mentally as well.
It really is for everyone. So where we hope to take the group in the future, As the outcome measures group mentioned earlier, all of our groups at Eastern State Hospital will be developing outcome measures. So that's something we're currently working with psychology and social work and rehab to do. So we're very excited about standardizing things and measuring the effectiveness of the group to make sure we can get it out to our patients the best we can. And then we are most excited about our upcoming research project. So we are collaborating with Eastern Kentucky University's Therapeutic Recreation Program. So we've met with them once, and we hope to have a research project started in the spring of 2020, if not sooner. So this will just continue to grow our group and make sure that we're bringing the best standard of care to our patients. So we are excited about it, and we hope to update you on what we've learned, and maybe we'll get on paper. So thank you guys for participating and listening to us.
And anytime that y'all want to come to our group, we have it Tuesdays and Wednesdays. We're always looking for people to come join us. So anytime, just let us know.
Thank you, guys.
Van Outer, and is it gonna come up? Yeah, there it is. Okay. Thank you. Okay, so I was working on a happiness challenge, and what I did is I went to Denver back in November to a magnet conference, and right about that time is when we start talking about Press Ganey, employee engagement. And a group there did a happiness advantage challenge. And I was really inspired by it. It was really exciting. And this magnet conference was enormous. I'd never seen, it was the biggest pep rally I've ever seen in my life, is what it was like. So Lauren and I, she's a Grade 2 nurse, brought it back. And my Press Ganey scores were not great. I was a tier 3, and I thought, my unit's awesome, and my nurses are awesome, and everybody's great. Why are we a tier 3? What is it? So you start looking through it, and I thought, I'm gonna bring this happiness advantage to my unit and see if we can reframe some of our thinking. Because what we do is stressful work. We've had a lot of changes. In healthcare, there's always a lot of changes. So we introduced it at, I believe it was the Ed Fair, just to get it into people's ears. You know, we went to this magnet conference, we saw this group, and the Happiness Advantage, by the way, and I have to bring the book because I love paper books still. I can't do electronic books. But it's by Sean Anker, The Happiness Advantage, How a Positive Brain Fuels Success in Life and Work. And pretty much what Sean Anker says is, am I still not loud enough? Okay, that's okay. I'll come closer. Thank you. What he says is we're kind of programmed to think that if we're successful, then we're happy. When in reality, it's the opposite. When you're happy, you become successful. So, and I brought this up here so I don't mess it up. It was a really cool quote from him. But he said, every time your brain has a success, you change the goal of what success looks like. If you've got a good job, you need a better job. You hit a sales target, then they're going to change the sales target. Or maybe it's a quality goal. And if happiness is on the opposite side of success, your brain never gets there. So what we've done is pushed happiness over the cognitive horizon. And I just thought that was fascinating. I didn't completely understand it, but I thought it was totally fascinating. So if we bring positivity to the present moment, your brain at positive performs better than it does at negative. And I thought, well, that has to help us, right? It has to help everybody. So what Sean Anker did is a 21-day challenge. And the 21-day challenge is there are 5 options that you do for 21 days. And those options, they're not hard if you read them, but they are hard when you try to do them. I failed miserably at the first challenge because I forgot to do them. But you can do 3 gratitudes, which is to take note every day of 3 things you're grateful for. You can journal, which I tried, and journaling is more difficult than I thought. You can exercise for just 10 minutes, which this drumming thing, where are you guys? I think that's awesome, yes. Or you can meditate or do random acts of kindness. And so what we did is we sent an email out to everyone that said, this is what we're going to do. And we're going to bring this happiness challenge. And if you want to participate, you can. So we gave them the rules for the challenge and then something to document on. And we sent it out, and we didn't get a lot of documentation back, but I did get some verbal feedback. The funny thing that we got back was a couple of men who I was surprised to hear from said it helped them lose weight. Of course, it would be men, right, that would lose weight. But, because it didn't do that for me. But anyway, so we did this, and we gave them one more opportunity to do it. And at the end, the way we were going to measure happiness is in March. We started this in January, the first happiness challenge. So this is still really new. But in March, we took our Press Gaining. And the unit came up from a tier 3 to a tier 1, which was incredible. Now, I don't know how I can absolutely tie that, but it's a positive result anyway. And we also looked at retention. And retention on one of our units was drastically reduced. So I started thinking, it's always when you're on the airplane and you have to put the mask on yourself before you can save anyone else, right? It was the caring for the caretaker. And the way that it can benefit our patients in the long run, and eventually employee satisfaction and employee satisfaction, patient satisfaction, and outcomes is, happy caretakers make happier patients. And I'm really excited to see where we can go with this. It's still very new. It's in its infancy. I need to get with Zim and see if he can help me figure out where else to go with it. But our outcomes, what we wanted to happen happened, and I'm hoping to continue. And what I would do is challenge everybody here to take the challenge. It is harder than you think it is. For one, I would go to bed at night and was like, I forgot to be grateful. And not that I wasn't grateful, but I forgot to think about it. I do it with my daughter all the time because it's much easier to have other people do things. So it's harder, but it works. And so that's the happiness challenge, and it's still going on, so keep your eyes open for it. I'm not sure where I'll go next, but I'm excited to see where it will go. So that's it.
So are there any questions for our last 3 poster presenters of the day? Oh, we've got one. And just let us know who this is directed to.
Cardio drumming. I'm so interested in giving Eastern State patients drumsticks. Tell me about that, because there are so many restrictions on what patients can have access to in a hospital that I'm really interested in how you got it approved to give like sticks to the patients.
So we're actually able to get a lot of supplies for our patients in the group setting. So this is off the unit. All the patients that come down to participate are in a level of support. So we expect that they will generally be able to participate without any behaviors. And we haven't seen any there yet. But we're always supervising with at least 2 staff in each group. So we feel pretty confident and trust our patients in that setting at least.
Are there any other questions for any other groups?
Could you not give them like plastic or something that wouldn't be as like wood or something that wouldn't hurt people as much? I mean,
even if you didn't want to use drumsticks, you could actually just get the cardio ball and use your hands. So that's something. Yeah. We haven't had any problems with the drumsticks yet, but I mean, if you're scared to use drumsticks, you could always just do your hands. So. I think she's just afraid she can't get it through.
Yeah.
Those are final questions. Oh, we have one in the front.
Hi, this is also for cardio drumming. So you said the group is for everyone. And I'm just wondering how you're able to adapt it to people with different physical abilities, just because I know that's an ongoing issue that we have in some of our more gym and fitness oriented groups, is that people are coming in at different levels and different abilities and trying to meet everyone's needs in one group. I know is a constant concern in there.
So that's actually something that we thought about before we even ordered supplies. So we have different sizes of the yoga ball. So we have a shorter and a taller version so that wheelchairs or chairs can be pulled up behind the balls. And we do have patients that are able-bodied but still get a little bit tired, and we always encourage them to pull up a chair if necessary. And then, as always, we can adapt movements and exercises to suit anybody. So.
As for cognitive functioning, we have different levels of routines that we have. So even if we have the hardest routine going, I mean, all we ask for is when a patient comes in is just to have a good time. So a lot of times we'll have that patient that they're not even looking at us, but they're having a good time because they're just kind of doing their own thing, own rhythm. So the main thing is that they are engaged. Doesn't matter if they're getting the full effect of the routine, but just that they're participating, having a good time.